So I work at Rush University Medical Center, which is in Chicago, Illinois. It's about 5 minutes away from me, located in the Illinois Medical District, right next to my school as well. For me, compared to some of my other friends who work at some of the other hospitals, I still work 40 hours a week, and I feel like I'm more valuable than ever now. Compared to some of my friends they're working about 20 hours, maybe 25 hours a week at some of the other hospitals. So not that that's any less important, but I'm blessed to still be working full time and to be able to have as much of an impact as I can within my workplace. And I am so happy that all of my coworkers are also being able to work at full time as well. Specifically within my internship, we're also doing medrecs 4 hours a week, Monday through Friday, and that's going into our P3 year. So that'll be for my year. I'll do a medrec every week for 4 hour shifts for the duration of the academic year. Last year, the P3s were able to go into the emergency department and go into the patient rooms and interview people there about their medication histories. We also had training going into this summer, and we had to use Cisco phones to call patients throughout the hospitals rather than go into the ED. Our pharmacists within the ED were uncomfortable with letting us go in, and we understood that as well. We respected it. This upcoming year, they're allowing us to go back into the ED and go into the rooms with the mask and taking necessary precautions to respect each other's distances. But I am struggling with being comfortable going into the ED still. But if we'll see what happens in about a month or so, if I'm coming to terms with some of it, and if not, then the workflow for doing it not in the ED is just using a Cisco phone and just calling patients throughout the hospital rather than the ED. And I have the option to do that if I'm more comfortable doing that. But we are still doing the medrecs. So everything within my internship program is for the most part staying the same, but workflows are different with respect to that.
Sure. So actually, it's been a pretty big impact from what we're used to. But I understand it's affecting everyone. So we've still been able to find ways to kind of adapt and get the work done. But obviously a lot less in-person activities and meetings and stuff like that. I've been lucky to be able to go into my site pretty much every day. But as far as like what I do on site is a little bit more remote work than before. Being in the ICU right now, I'm actually able to be pretty involved with direct patient care. But in like an ambulatory care setting where I was previously, it was a lot of like telemedicine, remote work. So the same with like the end of the school year. We did like online classes and, but I've still been able to go into like my hospital job and work out of a central pharmacy. But just like a lot more focus obviously on being like socially distant, and a lot more goes into the decisions about like, do you really like need to be in person, and trying to limit that as much as possible.
Yeah, so I currently work as a inpatient pharmacy technician at a hospital. So at the beginning of this pandemic, I started picking up more shifts at the hospital. And I feel very fortunate that my managers were very flexible with my schedule and very willing to allow me to come in. However, as an incoming third-year pharmacy student, I was looking forward to this being my last summer before completing my third year and starting fourth year rotations. So I had originally planned to do some more traveling this summer. However, the pandemic definitely shifted those plans inevitably. But I do feel fortunate that I was able to still go into the hospital and see my coworkers and the pharmacists that I work for, because I know a lot of my peers had all of their positions go completely remote during the start of this pandemic. So I am thankful for the opportunity to have been able to still go in. I've taken this time working more to improve upon my skills in the IV room and pick up more responsibilities at work. So I do believe that I have grown as a technician and pharmacy student by working more shifts at this time.